Good morning. Welcome to another video. And this video is about using B, vitamin D3, and the usage of vitamin D3. Welcome. So this is the vitamin D3 that I am using, and this one is called Ultra D 50,000 IU, and this is what it looks like. This is the box it comes in. So vitamin D3 benefits for glowing skin, heart health, and more. So I did my research. I bought that one off Amazon, and I did my research about using vitamin D3. Although I'm living on the island, I'm living in Antigua and Barbuda where lots of sunshine. Most times I might not be getting sufficient vitamin D3, which is essential for our body. And for you guys who are living in the cold, you're not getting sunshine at all, so you more than likely need vitamin D3. So vitamin D3 is most well known for promoting bone health, but this vitamin is also pivotal for boosting the immune system, enhancing mood and muscle function, and supporting heart health. Taking a vitamin D3 supplement may help you achieve glowing skin and better mental clarity. Your skin naturally produces vitamin D3 when exposed to the sun. Eating fish, beef, and cheese provides a natural boost of vitamin D3. Two still. Vitamin D3 deficiency is a common problem that can result in bone pain, muscle weakness, and spasm. Your health care provider may suggest a vitamin D3 supplement if you are deficient, live in a low sunlight area, or have a health condition like osteoporosis that would benefit from taking vitamin D3. In the United States, the Food and Drug Administration, FDA, does not regulate supplements the way it regulates prescription drugs. That means some products may not contain what the label says. When choosing a supplement, look for third-party tested products and consult a healthcare provider, registered dietitian, and nutritionist. 1. Bone health. Vitamin D3 plays a crucial role in the formation and maintenance of strong, healthy bones. Number 1. Vitamin D3 plays a crucial role in the formation and maintenance of strong, healthy bones. This vitamin is important for bone health because it enhances the absorption of calcium from our digestive tract, regulates the use of calcium and phosphorus for proper bone formation, supports support bone repair to maintain and regrow bone as needed, prevents bone disorders such as osteoporosis and rickets. So you see, if you're lacking a vitamin D3, what can happen to you? You may have osteoporosis or rickets. Low calcium intake and vitamin D deficiency are directly linked to the onset of osteoporosis. Researchers have found that older people who take vitamin D3 supplements and calcium supplements have a reduced risk of hip fractures and non-vertebral fractures, bones outside the spine. Number two, immune system. Vitamin D3 regulates immune responses, ensuring your immune system responds appropriately to pathogens and other suspected invaders. Your immune system requires vitamin D3 because the vitamin enhances the immune system's ability to fight infections, boosts the production of peptides that help defend against bacteria, viruses, and fungi, regulates inflammation, helps prevent the immune system from attacking the body's own tissues, boosts overall immune system. Some studies suggest that vitamin D supplementation may reduce the severity of certain autoimmune diseases such as rheumatoid arthritis, multiple sclerosis, and syndrome. However, there is no consensus on how best to use vitamin D3 to prevent or treat autoimmune diseases. Number three, mental health. So vitamin D3 is good for mental health. Low vitamin D levels are associated with increased symptoms of depression and anxiety. In fact, some experts recommend screening for low vitamin D levels when developing a prevention and or treatment plan for these disorders. Vitamin D3 is beneficial for your mood and mental health because it regulates neurotransmitters including serotonin and dopamine, which are responsible for regulating mood, supports the brain ability to learn, organize memories, and adapt to changes, neuroplasticity, reduces inflammation, which has been linked to several mental health and mood disorders, including depression, anxiety, and seasonal affective disorder. Numerous studies have examined the direct and indirect relationship between vitamin D and mental health. One standout revealed that people with vitamin D deficiency may be 75% more likely to develop depression compared to people with normal vitamin D levels. So you see, it is very important to. So it's very important to take your vitamin D, especially if you're not living in a country like mine. I am living on an island where I get sun right through the year, or sunshine in my island, on my island. So, and if I'm still lacking of vitamin D3, moreover, for people who are living in the snow in a cold country, you more than likely need to take vitamin D3. Okay, number four, muscle function. Although not everyone with vitamin D3 deficiency experiences symptoms, those who do commonly report muscle twitches, muscle pain, and muscle weaknesses. Vitamin D3 is beneficial for muscles because it maintains muscle strength, supports the contraction and relaxation of muscles, improving their performance, prevents. Hello, hi, Famisha, you're back. Welcome, honey, welcome. I'm talking about vitamin D3, the tablet. I have the 50,000 IU. I take it once per week. So I'm giving the benefits. I'm talking about the benefits of taking it. How are you today, Famisha? So maintain strength supports the traction and relaxation of muscle, improving their performance. Prevent muscle cramps. So vitamin D3 prevent muscle cramps and weakness by maintaining calcium levels. Oh, you're good. I'm happy to know that you're good, Famisha. That's very nice. I am home. It is rainy today, or it's very cloudy in Antigua. So I'm home and I decide to do this. Tell you about vitamin D3. Do you take vitamin D3? So vitamin D3 promotes muscle recovery after exercise by reducing inflammation and promoting muscle tissue repair. So after exercise, it's good to take. It's help. Do you take vitamin D3 tablets? This I'm talking about. I'm talking about this. No, I'm not going to work today. I'm not going to work. I'm home. I'm talking about this vitamin D3. Do you take it? So I'm giving you some of the benefits that it offers. So vitamin D3 promotes muscle recovery after exercise by reducing inflammation and promoting muscle tissue repair. So after exercise, when you take vitamin D3, it promotes muscle recovery and it reduces the inflammation and promoting muscle tissue repair. Vitamin D3 reduces muscle fatigue, weaknesses, and falls. Are you still in the purse? What's the purse? No. Yes, I'm still. Are you talking about the wallets? I still have some. Yes, I do have them if it's the wallets you're talking about. But now I'm talking about vitamin D3 and the benefits of taking this little tablets here. They're called vitamin D3. Yes. Okay, so vitamin D3 enhances overall exercise performance and endurance. Over 80 years of research indicate that sun exposure enhances physical performance. While these studies don't directly mention vitamin D3, it's likely that the enhancements are due to the benefits of vitamin D from sunlight and muscles function, growth, and repair. Good morning, Angie. How are you? From Misha. So so are you selling that? No, I'm not selling that. I'm not selling the vitamin D3. I'm taking it. So I'm just talking about it. But I'm not selling it for Misha. I'm not selling it. I'm just talking about it, honey. Okay. So number 5, cardiovascular health. So vitamin D3 is good for our heart health. Our heart muscle Yes, our heart is a muscle, so the vitamin D3 is also good for that. Yes, Famisha, are you at work today, Famisha? Vitamin D3, adequate vitamin D levels are crucial for preventing calcium imbalances in severe cases. Imbalanced calcium levels can lead to severe heart complications and may contribute to heart disease. Vitamin D3 is beneficial for heart health because it plays a key role in regulating blood pressure. Oh, you're driving, Angie. Okay. Okay, thanks for tuning in, Angie. Thanks very much. And Famisha, oh, you're not at work today, Famisha. Okay. All right. So, vitamin D3 plays a key role in regulating blood pressure, reduces inflammation, protecting the heart and blood vessels from cardiovascular disease. Vitamin D3 supports endothelial health, which is crucial for proper blood flow. The endothelium is the layer of cells lining the blood vessels. Vitamin D3 helps clean arteries and prevent author, Annalie, pronounce this to me. Atherosclerosis. Osteochlorosis. Analia are the buildup of plaque in arterial walls and significant risk factor for heart attacks and stroke. Vitamin D3 supports healthy cholesterol and triglyceride levels, thus reducing the risk of heart attack, heart disease. Research shows that high doses of vitamin D are no more effective for improving heart health than modest doses. Taking small to moderate amounts of vitamin D can effectively reduce your risk of heart attack, stroke, and cardiovascular disease. Ramisha, are you listening? Do you understand what I'm talking about, Han? Number 6, metabolic health. There is substantial evidence that taking a vitamin D supplement can help improve glucose homeostasis, steady blood sugar levels, insulin sensitivity, and overall metabolic health. Vitamin D is beneficial for metabolic health because it regulates insulin sensitivity, which is important for managing blood sugar and preventing type 2 diabetes. Vitamin D3 reduces inflammation, a significant risk factor for numerous metabolic disorders, including obesity and insulin resistance. Vitamin D3 helps your body break down, metabolize, and store fat. In people with pre-diabetes, taking a daily vitamin D supplement has been shown to reduce the risk of progression to type 2 diabetes. Evidence suggests vitamin D supplementation may reduce the risk of type 1 diabetes as well. Oh, you understand? Okay, good. Where you say you're from again? You're from Germany? Number 7, glowing skin. Vitamin D3 helps with glowing skin. So for those of you who are living in a snowy or a cold country, it is very good where you get less sunlight. It is very good for you to go and go to your pharmacy, go to your nutritionist, your dietitian, and ask them to prescribe a substantial amount of vitamin D3 for you, so you can get sufficient vitamin. Because lacking of this, the result is not nice if you're not having vitamin D3 in your blood. So glowing skin for people who wish to brighten dull skin and prevent or relieve inflammatory skin conditions. Maintaining healthy vitamin D levels is critical. Vitamin D3 offers numerous benefits for skin. The sunshine vitamin. So the name for vitamin D3, the next name is sunshine vitamin, because you can also get vitamin D3 from the sun. I am living on the island and I still take this because my vitamin D level is still low, so I'm still not getting the sufficient vitamin that I need. Moreover, for those of you who live in a cold country and you're not getting minimum sunlight. Okay, Famisha said okay. So vitamin D3 plays a crucial role in skin cell growth and repair. Vitamin D3 supports a strong and healthy skin barrier, which is essential for locking in moisture and preventing harmful microbes, chemicals, and allergens from penetrating your skin. Vitamin D3 enhances the wound healing process, reducing the risk of infection. Vitamin D3 promotes glowing skin by improving skin tone and texture. Vitamin D3 protects your skin from damage due to UV rays from the sun. Vitamin D3 reduces the risk of many skin conditions, including acne, psoriasis. Psoriasis. So you see, most of my clients, because I'm a massage therapist. Most of my clients that I deal with, they have skin condition like psoriasis. So vitamin D3 helps with that. It reduces the risk of psoriasis. So please do. I'm good, Famisha. I'm here with my daughter. She's not going to school today, so she's right beside me. She's listening. Yes. So I was saying I am a therapist, a massage therapist. I've dealt with clients that most of them are from abroad in the cold country. And most of them that I've done have, psoriasis. So the vitamin D3 it helps with that, and it also prevents that as well. It prevents the psoriasis. It reduces the risk of many skin conditions, including acne. So if you're suffering from acne and psoriasis and eczema, like my daughter she's suffering from eczema, and I guess maybe because of the lacking of vitamin D3 while I was pregnant, I am lacking of it, so I guess she born with that condition. She has eczema. So vitamin D3. Famisha, do you take vitamin D3? Vitamin D3 may reduce the risk of skin cancer. Oh, so you heard that. Vitamin D3 may reduce the risk of skin cancer, can reduce the appearance of age-related fine lines and wrinkles by promoting skin renewal and repair. Let me read it again. Vitamin D3. Can you hear me? Because maybe most people not hearing me. Can you hear me, Famisha? Let me know if you're hearing me. Vitamin D3 may reduce the risk of skin cancer, can reduce the appearance of age-related fine lines and wrinkles by promoting skin renewal and repair. Vitamin D3 supplements and skincare products containing vitamin D are often recommended for people with sensitive, mature, and aging skin and skin that is prone to redness and visible blood vessel. Oh, so Famisha says she can hear me. So Famisha, give me a thumbs up. Look down up there, you see a thumbs up the live for me, please, Famisha. Okay, number 8. Morning to it. Hi Shelly, how you doing? Okay. Angie is still there. Okay. Welcome Shelly. Welcome honey. Yes. So, I hope you guys are taking your vitamin D. You're just like, thank you very much Shelly. Thank you. Famisha, if you're still there, give me a thumbs up, Famisha. Thank you. I'm talking about vitamin. I'm talking about vitamin D, D3, the sunshine vitamin. If you're not in a hot country like if you're not living on the island, and me who is living on the island, I have to be taking this much less. For those of you who are living in the cold country, you need to have it in your diet. Famisha, give me a thumbs up. You're still on the live. Give me a thumbs up, baby girl. Okay, cognitive function. Vitamin D3 is thought to have many benefits for your brain and cognitive health. Vital for cognitive health and function. Vitamin D3. Vitamin D3 protects the brain from inflammation and cell damaging free radicals, both of which are linked to cognitive decline and neurodegenerative disorders like Alzheimer's disease. So vitamin D3 can prevent that. Vitamin D3 can prevent you from getting inflammation in the brain. It also, Famisha, what that mean? Vitamin D3 it can also help with Alzheimer. Oh, you already give me a thumbs up? Oh, I don't see it on the live, but if you said you already do, thank you very much. If you said you already do. So, vitamin D3 helps with Alzheimer's disease, or it can help to prevent Alzheimer's disease. I have a aunt, she's 86, and she suffers from Alzheimer's disease. That means lack of memory. She remembers something sometimes, and especially she only remember the old time things. She don't remember the recent things. If you said hello to her now, by the time you come 1 second and said hi, what's my name, she don't remember. But she can tell you from 1920s. She can only remember old things. So vitamin D3 helps with your memory and helps, to prevent that. So vitamin D3 supports proper cognitive development. Healthy vitamin D levels have been linked to improved learning and memory in both children and adults. Vitamin D3 stabilizes mood and reduces the risk of mood and mental health disaster. Vitamin D3 promotes neuroplasticity, further reducing the risk of neurodegenerative disorder. Vitamin D3 reduces the risk of brain infection. Do you want me to read over that? Okay, vitamin D3 supports proper cognitive development. Healthy vitamin D levels have been linked to improved learning and memory in both children and adults. Vitamin D3 stabilizes mood and reduces the risk of mood and mental health disaster. Vitamin D3 promotes neuroplasticity, further reducing the risk of neurodegenerative disorder. Neuro mean it has to do with the nerve. It has to do with the nerve. So it prevents you from have drained nerves or prevent your nerve from drain. Famisha, are you still there or are you gone? Vitamin D3 reduces the risk of brain infection. Some evidence suggests that vitamin D deficiency, when it occurs both before birth and throughout life, may contribute to the development of numerous diseases. In fact, in expectant mothers with vitamin D deficiency, there appears to be a greater risk of the infant developing autism, schizophrenia, like disorders, and other mental illness later in life. Oh Lord, I hope you don't. Oh, you're still there, my friend. I hope you don't develop that analia. Cause maybe I was deficient of vitamin D. I don't know. I hope you don't develop autism and schizophrenic like disorders and other mental illness later in life.
Don't relax.
Okay. Okay, let me read over that again for Misha. Let me read that again. Some evidence suggests that vitamin D deficiency, when it occurs both before birth and throughout life, may contribute to the development of numerous diseases. In fact, in expecting mothers with vitamin D deficiency, there appears to be a greater risk of the infant developing autism, schizophrenic like disorders, and other mental illness later in life. So, so you see, if you're deficient of vitamin D and you're expecting, or you're expecting mother, the child may develop autism or schizophrenic like disorder or other mental illness later in life if you're vitamin D3 or vitamin D deficient. Okay, number 9, digestive health. Vitamin D3, a growing body of research shows that vitamin D supplementation has preventive benefits for digestive health. Vitamin D3 is important for digestive health because it promotes a healthy and balanced microbiome, or the ecosystem of microbes that live in your digestive tract and influence your overall health. Vitamin D3 protects against gut inflammation and disorders linked to it, including inflammatory bowel disease. You know, some people say they suffer from irritable, what they call it, irritable IBD, irritable bowel disease, or Crohn's disease, or ulcerative colitis. Vitamin D, we got that.
I cut it on the head.
You can, you
It's a
cannot,
Brazil, it's all Brazilians.
you cannot cut that from my wig, Analia. Sorry about that.
No, it's
You
all
cannot cut my
Brazilians.
wig.
It's that.
You must be crazy, little girl. You're not putting that in your hair because you did not ask me, so you're not going to put that
Can I
in your hair.
ask?
No, Analia, you went and cut my stuff before and then you come and no, no, no. Sorry about that, Famisha and the other online. So vitamin D3 protects against gut inflammation and disorders Linked to it including inflammatory bowel disease, Crohn's disease, and ulcerative colitis. Vitamin D3 improves the function of immune cells in your gut, preventing against gut infections, enhances the epithelial lining in your gut by turn enhancing the absorption of key nutrients like calcium and magnesium. Vitamin D3 prevents constipation by regulating gut motility or the movements of the digestive system that push food from the stomach through the intestines and out the body. So you see all of that what vitamin D3 can do. Analia, why you cut my stuff? Just a minute information. Okay, Kamisha. People with irritable bowel syndrome, IBD, often have vitamin D deficiency, even during remission. Having a vitamin D Having a reduced level of vitamin D is also a risk factor for worsened irritable bowel syndromes. So you see, Famisha, a lot of people, they're suffering from irritable bowel syndrome or IBD because they're vitamin D deficient. So if you know of anyone is suffering, vitamin D is good. Number 10, pregnancy health. Vitamin D deficiency is a significant risk factor for several problems in both expecting mothers and their infants. Having adequate vitamin D3 levels is critical during pregnancy because it reduces the risk of the following: preterm birth and low birth weight, infant mortality with the first month of life, recurrent miscarriages. Bacterial vitamin D3 helps with bacterial vaginosis in the expecting mother, gestational diabetes mellitus in the expectant mother, preeclampsia in the expecting mother. So vitamin D3 helps with all of that. Vitamin D supplementation may also reduce the risk of the infant developing attention deficit hyperactivity disorder, autism expectant disorder, autism spectrum disorder, and other mental development issues in childhood. Some experts suggest that all pregnant people should take a vitamin D supplement at least 400 IU per day to ensure adequate vitamin D levels and prevent pregnancy complications. Talk to your healthcare provider if you are pregnant and considering vitamin D supplements. Number 11, cancer prevention. This thing, let me put on this light. Farmisha, you still there or you gone? I'm going to put on this light. Woo, this light is so bright and nice.
Ooh, that's so cute.
Yeah, I'm going to put it on. Right. Yes, Analia. You're still there? Okay, Famisha. Okay. 11, cancer prevention. Researchers started investigating vitamin D role in cancer prevention after noticing that people in southern regions with eye sun exposure appears to have lower cancer rates and mortality compared to those in northern regions with less sun. Evidence suggests that vitamin D supplementation may reduce the risk of some cancers, including breast, bladder, lungs, and colorectal cancers. But more studies are needed. Vitamin D3 enhances the immune system's ability to detect and destroy cancer cells, slows the progression of existing cancer cells, reduce the side effects of cancer treatments, and improve quality of life. Vitamin D3 helps maintain bone health and density in people receiving chemotherapy. Farmisha, are you there or are you gone? They said this light bright. Ooh. Are you there, Farmisha, or you leave me? You gone? Or you leave? Vitamin D3, it's important to note that the overall research on this subject, mixed with some studies showing no benefit for cancer prevention at all. If you have been diagnosed with cancer or undergoing cancer treatment, consult with your healthcare providers before starting vitamin D or any other supplement. Oh, you're still there. Okay. Number 7. Number 12, weight management. Vitamin D supplementation appears to have several benefits for people with overweight or obesity who are trying to lose weight. Vitamin D3 is beneficial for weight management because it helps regulate hormones like leptin that are involved in stimulating appetite, promotes a healthier body composition with less excess fat and more muscles. So vitamin D3 help with muscles, help with weight loss. Vitamin D3 boosts muscle function and strength. Having more muscles means you burn more calories at rest. Vitamin D3 improves insulin sensitivity, which also enhances fat burning. I am not done for Misha, but if you want to go, honey, you can go. I'm not done. I'm going to be here for a long time, honey. I'm not finished. I'm going to be on the live for a long time. So if you have something to do and you want to go, you can go, honey. Thanks for your input. People with vitamin D deficiency are more likely to have a high body mass index compared to people with adequate vitamin D levels. According to one clinical trial of women with overweight and obesity, women who took 50,000 IU of vitamin D per week had reduced waist circumference and body mass index after 6 weeks. Keep in mind that taking 50,000 IU of vitamin D per week is well over the recommended daily intake. The maximum safe dose of vitamin D supplementation is 4,000 IU per day. Do not exceed this amount unless supervised by a health care provider. Oh, you don't want to go? Okay, Farmisha. I'm not done though. Number 13, healing and recovery. Having adequate vitamin D level is vital for your body's ability to heal and recover from infections, injuries, and other ailments. Beneficial for healing and recovery in vitamin D3. Vitamin D3 accelerates the growth of healthy new cells, strengthens the skin barrier, increases immune system activities that are essential to wound healing, reduces inflammation, protects against bacterial infections. Having adequate vitamin D level is also known to enhance the healing of bone fractures. More research is needed to determine a safe and appropriate vitamin D3 dosage for these purposes. Blood pressure, vitamin D3 and blood pressure. Hypertension, more commonly known as high blood pressure, is cardiovascular disease commonly seen in people with vitamin D deficiency. So if you notice you're suffering from high blood pressure or hypertensive, check your vitamin D level. Oh, your favorite thing is going live. Oh, you like live? Okay, okay. Did you watch the live when I did the beach live yesterday? Go and look at the beach live. So, if you know of anybody who have hypertensive or high blood pressure, they may be very well suffering of a vitamin D3 deficiency. Recent studies suggest that vitamin D3 may help lower blood pressure in people with hypertension and vitamin D deficiency, as well as certain groups of people with hypertension only. Yes, I had a beach live yesterday, about 2 hours. According to a 2019 review of studies in the journal Medicine involving the first 687 people, vitamin D3 was able to significantly reduce systolic top number blood pressure in people over the age of 50 and those with obesity. Oh, yes, I did that. Yes, I did that. It was massive. I spent about 2 hours yesterday on that video. Vitamin D3 and hair loss prevention. Vitamin D deficiency has been linked to several hair loss disorders, including telogen effluvium and alopecia areata. So you see? So vitamin D3 can help with your hair loss or alopecia areata. It has also been linked to scarring alopecia, a disorder that results in permanent hair loss. Supplementing with low levels of vitamin D3 can effectively improve symptoms of these alopecias due to the vitamin's anti-inflammatory and immune regulating effects. Who needs to take vitamin D3? If you have an existing vitamin D deficiency or at risk for developing one, you may need to take a vitamin D supplement. You are at greater risk for vitamin D deficiency if you have celiac disease, Crohn's disease, cystic fibrosis, gastric bypass surgery, liver disease, malnutrition, obesity, ulcerative colitis. I need to read that over. Did you hear that, Famisha? Did you hear that one? Yeah, I wanted to see my face bright and bright. Did you hear that one? Who needs to take vitamin D3? If you have an existing vitamin D deficiency or at risk for developing one, you may need to take a vitamin D supplement. You are at greater risk for vitamin D deficiency if you have celiac disease, Crohn's disease, cystic fibrosis, gastric bypass surgery, liver disease, malnutrition, obesity, ulcerative colitis. So if you're suffering from one of these diseases, you're more than likely to have vitamin D deficiency. You may also need to take a vitamin D3 supplement if you are housebound, spend long hours indoors, live in a region with low sunlight, have dark skin. Oh, so you see, that's why I was vitamin D deficient. That's why I was vitamin D deficient. Famisha, are you still there or are you gone? That's why I was vitamin D deficient. So let me read that over. You may also need to take a vitamin D3 supplement if you are house housebound, spend long hours indoors, live in a region with low sunlight, have dark skin. Your provider may recommend a vitamin D3 supplement if you have an ailment that would benefit from it. Vitamin D3 supplements are commonly recommended for people who have or are at an increased risk for osteoporosis, inflammatory bowel diseases, autoimmune diseases, heart diseases, metabolic diseases, cancer. Let me read it again. Your provider may recommend a vitamin D3 supplement if you have an ailment that would benefit from it. Vitamin D3 supplements are commonly recommended for people who have or are at an increased risk for osteoporosis, inflammatory bowel diseases, autoimmune diseases, heart diseases, metabolic diseases, disorder, and cancer. How much vitamin D3 should I take daily? The National Academy of Medicine recommends a daily intake of 600 IU of vitamin D for people ages 1 to 70 and 800 IU for adults ages 71 and over. The majority of vitamin D intake should come from food. The maximum safe dose of vitamin D3 is 4,000 IU per day. Do not exceed this amount without consulting a healthcare provider. Symptoms of vitamin D3 deficiency. Not everyone with vitamin D deficiency experiences symptoms. When symptoms do occur, they may include muscle pain, bone pain, increased sensitivity to pain, tingling or pins and needles sensations in hands or feet, muscle weakness in body parts near the trunks of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle spasm, bowed legs in severe cases. So you will know if you have vitamin D deficiency. Let me read again. Symptoms of vitamin D3 deficiency. Not everyone with vitamin D deficiency experiences symptoms. When symptoms do occur, they may include muscle pain, bone pain, increased sensitivity to pain, tingling or pins and needles sensations in hands or feet, muscle weakness in body parts near the trunk of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle spasm, bowed legs in severe cases. Sources of vitamin D3. So let me read it again for anybody coming on. Famisha, are you still there? Okay, let me read. Sources of vitamin D3. So it's going to tell you, this is going to tell you where you can get your vitamin D3 from. Oh, you're still there, honey. You're
I'm not finished yet.
huh?
I'm not finished yet.
Anisha, are you still there? Yeah. Okay, so the sources of vitamin D3. So this is going to tell you where you can get your vitamin, what food you can eat so you can get your vitamin D3 from. Sources of vitamin D3, whether you are nutritionally deficient or simply want to meet your recommended daily intake of vitamin D, you can get vitamin D3 from, stop shaking the bed, Analia. Animal-based foods should be your primary source of vitamin D. Key sources include cod liver oil, salmon, trout, halibut, mackerel, fortified milk, cheese and beef liver, some fruit juices, dairy products, margarine, and plant-based milk are fortified with vitamin D3 for added nutrition value. So you see where you can get your sources, what food you can eat to get your sources of vitamin D3 from. Let me read it again. Sources of vitamin D3. Whether you are nutritionally deficient or simply want to meet your recommended daily intake of vitamin D, you can get vitamin D3 from animal-based foods. Food should be your primary source of vitamin D. Key sources include cod liver oil, salmon trout, halibut, mackerel, fortified milk, cheese and beef liver, some fruit juices, dairy products, margarine, and plant-based milks are fortified with vitamin D3 for added nutritional value. Dietary supplements. Supplements should not be your main source of vitamin D. They should only be considered when you cannot get enough vitamin D from your diet. Vitamin D3 is available in capsules, soft gels, gummies, and liquid drops. Consult your healthcare provider for the best dosage based on your age and medical history. Let me repeat it again. Dietary supplements should not be your main source of vitamin D. They should only be considered when you cannot get enough vitamin D from your diet. Vitamin D3 is available in capsules, soft gels, gummies, and liquid drops. Consult your healthcare provider for the best dosage based on your age and medical history. Sun exposure. The compound 7-hydrocholesterol in the skin converts UVB light into vitamin D3 production. Varies from age and skin tone. With older adults and those with darker skin, producing less sunscreen can also reduce vitamin D3 production by blocking UV rays. While daily sunlight helps maintain vitamin D levels, It's not the safest method due to the risk of skin cancer. When is the best time for taking vitamin D3? Vitamin D3 is a fat-soluble vitamin. This means that taking it with fat helps it absorb better. It doesn't matter what time of day you take it, but you should eat fat-containing food when you do. So when you're going to take your vitamin D supplement, take it with a fat-based diet because it absorbs better in fat. So fatty food, you eat, yes, so it absorbs better with fatty food. So you take it. Okay, so possible risk of vitamin D3. Vitamin D3 is generally considered safe, but it can occasionally cause toxic effects if you take too much. This is referred to hypovitaminosis D. With vitamin D toxicity, the balance of minerals like calcium and potassium is upset. This can lead to a condition known as hypercalcemia, in which too much calcium builds up in the body. This can lead to symptoms like stomach upset, nausea, vomiting, constipation, bone pain, muscle weakness, and increased risk of bone fractures. People with hypoparathyroidism. Oh. People with hypo, hypoparathyroidism, kidney disease, or hyperglycemia, high blood pressure, calcium should typically avoid vitamin D3 supplements. Certain medication can also interact with vitamin D. Speak with your healthcare provider or pharmacist before starting any supplements. Hyper, the hyperparathyroidism. Okay. Okay, so vitamin D3 helps you absorb calcium and phosphate from food. It is important for bone and muscle strength, improve function and healthy skin. It may also help prevent numerous diseases, including inflammatory bowel disease, heart disease, and infections. Diseases you can get vitamin D from. You can get vitamin D from food or supplements, and your body can make D3 when exposed to sunshine. Talk to your healthcare provider if you have a medical condition that might benefit from taking vitamin D3 supplements. The upper limit for safe vitamin D supplementation is 4,000 IU per day. Do not take more than this unless directed by your healthcare provider. So this is the ending of the vitamin D3. Farmisha, is that you on there? I am finished with the vitamin D3. So those are the benefits and the side effects of taking the vitamin D3. Farmisha, is that you on there? So I'm finished. I am so finished with reading the vitamins. So also some people just come in. So let me just read over some of the benefits of the vitamin D3 because I'm finished now, but some people are just popping up little by little. Let me see. So it's after 10 now for Misha. Where I'm at is after 10. What time over your place? Okay, so let me read the benefits again before I close this live. So vitamin D3 helps you absorb calcium and phosphate from food. It is important for bone and muscle strength, immune function, and healthy skin. It may also help prevent numerous diseases, including inflammatory bowel disease, heart disease, and infectious diseases. You can get vitamin D from food or supplements, and your body can make D3 when exposed to sunshine. Talk to your health care provider if you have a medical condition that might benefit from taking vitamin D3 supplements. The upper limit for safe vitamin D supplementation is 4,000 IU per day. Do not take more than this unless directed by your health care provider. Let me read again since more people are coming. Vitamin D helps you absorb calcium and phosphate from food. It is important for bone and muscle. Oh, in the night. Wow. It is important for bone and muscle strength, improve function, and healthy skin. It may also help prevent numerous diseases, including inflammatory bowel disease, heart disease, and infectious diseases. You can get vitamin D from food or supplements, and your body can make D3 when exposed to sunshine. Talk to your healthcare provider if you have a medical condition that might benefit from taking vitamin D3 supplements. The upper limit for safe vitamin D supplementation is 4,000 IU per day. Do not take more than this unless directed by your healthcare provider. It's in the morning? It is in the morning, really? And it's after 10 years? Where you say you're from again? It's not Germany you say you're from Misha? Okay, so let me tell you the sources of vitamin, where you can get, which food you can eat to get your vitamin D3 to help you out. Really? So it is in the morning for, I don't understand that. I thought it would be later than that. Sources of vitamin D3. Whether you are nutritionally deficient or simply want to meet your recommended daily intake of vitamin D, you can get vitamin D3 from animal-based foods. Food should be your primary source of vitamin D. Key sources include cod liver oil, salmon, trout, halibut, mackerel, fortified milk, cheese, and beef. Liver, some fruit juices, dairy products, margarine, and plant-based milks are fortified with vitamin D3 for added nutritional value. Love you too, Farmisha. You can get your vitamin D3 from dietary supplements. Should not be your, so they say dietary supplements should not be your source of, your only source of vitamin D. They should only be considered when you cannot get enough vitamin D from your diet. Vitamin D3 is available in capsule, soft gels, gummies, and liquid drops. Consult your healthcare provider for the best dosage based on your age and medical history. Oh, thanks for the live. Whoever put that thing there, thanks for the thumbs up. Some exposure. So Farmisha, tell me something. But in how many hours Germany? How many hours Germany is from Antigua? Cause now it's after 10. So how many hours? So you can get vitamin D3 from sun exposure. The compound 7D cholesterol in the skin converts UVB light into vitamin D3. Production varies by age, skin tone, and with older adults and those with darker skin producing less sunscreen can also reduce vitamin D3 production by blocking UV rays, while daily sunlight helps maintain vitamin D levels. It's not the safest method due to the risk of skin cancer. Hi! Hi, my darling. Hello, my UK girl. How are you? Um, Thanks for the thumbs up. Thank you very much. I'm talking about the vitamin D3, and I'm sure you're in cold UK. Are you taking any supplement? Are you taking any vitamin D supplement or what? Tell me about it. I miss you. I miss you. I miss you. See, I have a new friend named Famisha. She has been keeping my company. And I finished read over all this thing. So I'm going to tell you where you can get your source of vitamin D3. I done read off all of that already. I'm going to tell you the signs. Oh, you know you. Yes, so you should take your vitamin D supplement, man. The correct amount to take is 4,000 IU per day. Your daily dose is 4,000 IU. This is 50,000 IU, but I can only take this once per week. One per week. But the safe dose is 4,000 IU or 400 IU as a daily dietary supplement. So is it very cold in the UK now? It's very cold, right? So this is the symptoms. How you're going to know that you're deficient or you have less vitamin D3. Not everyone with vitamin cold with sunshine crazy. Really? What you saying to me? So you're getting cold and plus you get sunshine. I don't understand that. So you're still cold with all them sunshine that you get? Oh, what a joke at all. You not put this in your ear, Analia? You're not using it?
Yes,
So what you put it there for?
I'm using it.
It's very crazy. It is very, very crazy because we don't know how comes you get you're cold and plus the sun is out. I don't know. I don't know what's that. Well, in Antigua here, it's cloudy. It's not too sunny today. It's very cloudy. Very, very cloudy. Very, very cloudy. Maybe sometimes I don't know what, and I don't go to work today. I said, let me just stay home and just let me just come on and see what I should talk about. Cause you tell me you like this something there thing. What I should talk about. Tell me, I don't know what to do with this channel. Tell me what I should do, baby
Tell
girl.
you how to teach you how to do here.
What?
Tell you to teach you how to do here.
I can do here. Let me do your hair for you. Who used to do your hair when you was a little girl? Who? It wasn't me?
Okay, then pat my ear for me then.
Stop shake up the bed. Oh, Famisha. Oh, my friend gone. She gone. Famisha, darling, I should talk about skin. I should talk about skincare. So if we talk about skincare, I should talk about skincare. I wonder what I should talk about skincare now. All right, I'm going to look into that. I'm going to look into that. I'm going to look into skincare and see. Okay, so some more people come on. So symptoms of vitamin D deficiency. So if you want to know if you have vitamin D3 deficiency or vitamin D deficiency, meaning your lack of vitamin D, this is how you're going to know. Not everyone with vitamin D deficiency experiences symptoms. When symptoms do occur, they may include muscle pain, bone pain, increased sensitivity to pain, tingling or pins and needles sensation in hands or feet, muscle weakness in body parts near the trunk of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle spasm, bow leg in severe cases. So if you're experiencing some of these, you may have a lack of vitamin D3, so you can go to your doctor. You know, I was in the UK the other day. I was in Hertfordshire, St. Albans, and I forget to do a live because I forgot to do a live, right? I didn't want to do a live.
You don't want to.
I didn't want to do a live. Me and my daughter, we were there in August. We spent 1 month there. It was so nice. So nice. It was so nice. Let me take that call here. It was so nice over there. Hello? Uh, Hi, darling. What's up? Yes. Me dey on one live, so me will call you back, right? Yeah. And she said, Hertfordshire, wow, not far at all. Hope you had good. Yes, we had good times. We had good times. And anyhow, me did do a live there, you would have seen. But me said, sure, me never want nobody know my business. So me never come on YouTube for about 2 years. About 2 years me haven't done a live on YouTube and so forth. Less you would have known. We had good times. We love it. We love it in the UK. It's nice. It's nice. Very, very nice. So those are the symptoms of vitamin D deficiency. Muscle pain, bone pain, increased sensitivity to pain, tingling or pins and needles sensation in hands or feet, muscle weakness in body parts near the trunk of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle spasm, bow legs in severe cases. So that's the symptoms, some of the symptoms if you're lacking of vitamin D3. And the safe doses of vitamin D3, which for you to take daily. How much vitamin D3 should I take daily? The National Academy of Medicine recommends a daily intake of 600 IU of vitamin D for people ages 1 to 70 and 800 IU for adults ages 71 and over. The majority of vitamin D intake should come from food. The maximum safe dose of vitamin D3 is 4,000 IU per day. Do not exceed this amount without consulting a healthcare provider. Not everyone with vitamin D deficiency experiences symptoms. When symptoms do occur, they may include, as I said, muscle pain, bone pain, increased sensitivity to pain, tingling and pins and needles, sensation in hands or feet, muscle weaknesses in body parts near the trunk of the body, such as upper arms or thighs, muscle weakness in hips or legs, which may cause you to waddle while you walk, increased risk of bone fractures, muscle skin, bone legs in severe cases. Yes, so okay, so this one says, who needs to take vitamin D3? If you have an existing vitamin D deficiency or at risk for developing one, you may need to take a vitamin D supplement. You are at greater risk for vitamin D deficiency if you have celiac disease, Crohn's disease, cystic fibrosis, gastric bypass surgery, liver disease, malnutrition, obesity, ulcerative colitis. Hi, Famisha. My girl Famisha is back. I already read all these already. And you was on it, so I don't have to read them over. You're back, Famisha. You're not going anywhere. So you're at work? So you're home right now. Okay, that's nice. So more people keep coming on while things. So I have to read. Let me read this part here for Misha for them. Hair loss prevention. So vitamin D3 prevent hair loss prevention. Vitamin D deficiency has been linked to several hair loss disorders. Vitamin D deficiency. So if you lack of vitamin D, it has been linked to several hair loss disorders. So if you notice your hair falling out, and you notice you're having bald spots, patches here, there, and everywhere, you might be lacking a vitamin D deficiency. So you need to go and consult your doctor or your dietitian or your nutritionist. So hair loss prevention. Vitamin D deficiency has been linked to several hair loss disorders, including telogen effluentia and alopecia areata. It has also been linked to scarring of alopecia, a disorder that results in permanent hair loss. Supplementing with low levels of vitamin D3 can effectively improve symptoms of these alopecias due to the vitamin anti-inflammatory and immune modulating effects. So if you, what time is it up there? It's 10:32. It's 10:32. So if you notice that if you already have alopecia, and alopecia is a permanent hair loss, if you notice you have bald spot here, bald patch there, or whatever, you can take a low level of vitamin D3 and it might help the condition. It might help your condition. So what time it says over there? What time is over there now for Misha? Right, so if you notice that, or if you already have alopecia, meaning your hair is falling out and it's not growing back, you can use a low level daily of vitamin D3, and that will help to improve your condition. It will help to improve. Okay, it's 8:32. It will help to improve your condition. So this is who needs to take vitamin D3. Who needs to take vitamin D3? If you have an existing vitamin D deficiency or at risk for developing one, you may need to take a vitamin D supplement. You are at greater risk for vitamin D deficiency if you have. So if you have one of these, you may be deficient of vitamin D3. Celiac disease, Crohn's disease, cystic fibrosis, gastric bypass surgery, liver disease, malnutrition, obesity, ulcerative colitis. You might have vitamin D, deficiency of vitamin D3. Yes, I take vitamin, and this is my vitamin D3 that I'm going to take one right now. I take loads of vitamin, girl. Loads of vitamin. See? This is what I'm going to take. It's one per week. Cause this is a 50,000 IU, so I can take it every day. It's very, very strong. The 50,000 is absolutely strong. So you have to take one time per week. The normal one, you can take a 600, 800, or 4,000. That is recommendable doses daily. But this is once per week I can take this. Yes, 50,000 is very, very strong. So once per week. And it's a little capsule. As you can see, can you see it? A little capsule. See there? It's a little capsule. So my friend said I should do skincare. So that's it. I think that's it for the vitamin D3. People are coming little by little. I can't take when they come little by little. And me done read off already. Hey, may I come on your wedding, man? I'm coming. Thanks for the invitation. I will be there. You want to do skincare, so I want to do skincare. You want to do it, or you want me to do it? Which one? What are you saying, Famisha?
You
What
get
are?
it free for you?
Huh?
You get it free for you?
Tomorrow? When I coming back? Oh, you want me to do that? Oh, but I ask you. I think I ask you sometimes what you want me to do, and you tell me you don't know. No, you said you're okay. Okay, I'm going to look into that. I will look into that, Famisha. I will look into the skincare. I will definitely look into the skincare. No, Annalie, I'm doing when I leave work. Remember, I'm going to work tomorrow, so when I leave, I will just drive up to the food fair. Tomorrow is a national holiday. Antigua first 45 independence, so it's going to be a holiday tomorrow. It's going to be a holiday tomorrow for Misha here. I think we have a skincare journal, you know. Let me see. Something. Um, um, what the lady they give to me. Yes, it's going to be a holiday tomorrow. Let me buy. What's your name? Pasta. So I might go live. I'm not sure. Yes, I might go live. Pastor God's wife. Let's see. Somebody. God. Yes, I might go. I may. I'm going to work tomorrow. I may go so y'all can
But
see.
if you're going, you want pasta.
Huh?
If you're
I
going,
don't know if I'm going, and if I go, it's just drive through. Do you have to go? So I have to go work tomorrow, so I'll video it. I'll video it when I'm coming back from work. I'll video it when I'm coming back from work. When I'm coming back from work, I'll video it tomorrow. Anyway, Famisha, thank you very much for coming. I'm going now, darling. Thank you very much. So this helpful, you see? Thank you very much for coming, honey. You have a beautiful day. Oh, people are coming in, but I'm going now. If you want to see what I spoke about, you will have to watch the live because I'm finished now and I'm going. Thank you guys for watching. I'll come back another day with another beautiful health tip. I'll come back another day with a beautiful health tip. Oh, Johan, thank you. Okay. Yes, and I'm gonna do the skincare. So you'll see. You will see the skincare, my friend, my beautiful friend. Thank you very much, and you take care, right? I'll see you again. Yeah, I'm going to do it. So thanks very much. You have been on that channel for a long time, for about over 2 years. So thank you. See you. Bye bye.